Let's talk depression. This is the third and the last video in the series of depressive disorder. The first video we covered the way we are and the way we perceive life events and our vulnerabilities to make us more sensitive towards depression. The second video, we talked about signs and symptoms of depression and the way we feel when we are depressed. This third video is about the management of depression. Now, depression presents as mild, moderate, severe. In mild depression, your sleep, appetite and mood will be affected. And you are going to start waking up in bad mood. And you may start becoming more sensitive. People around you will notice the difference. People who know you will notice the difference. The first step you should take is do not let yourself suffer in isolation. Talk to somebody. Talk to someone whom you trust and confide in. We all have someone in life whom we can trust and talk to. Sometimes we don't realize that, but people are there who love us and people are there who keep the best of their wishes for us. Talk to people. Number 2, bring some basic changes in your lifestyle. Sometimes incorporating basic exercise, improving diet. Look at your diet. If you are on an unhealthy diet, improve on it. Reduce workload if you are finding that. Try to find the cause and the reason for it. And try to address the reason. If depression is secondary to something, you've got to get to the root cause of it. And that will release the stress. But then depression can progress to mild to moderate even after taking all the basic advice and making the changes in our life. Then what to do? For moderate depression, mild to moderate depression, psychological therapies are beneficial. You don't really need a psychologist for mild depression. You may have a very good friend or someone in a supportive role whom you can talk to and offload yourself. For mild to moderate, you will need psychologist, but you don't necessarily need to look for someone with 20 odd years experience or something. No, you can go to a counseling psychologist or go for a supportive counseling where you can afford offload yourself in a professional setting. Now, even then, if depression progresses to severe degree, then you need treatment. At that stage, you would benefit from seeing a psychiatrist and have a proper treatment for your medication. By this time, the chemicals of happiness would have been reduced and the chemicals of sadness would have been increased in your brain cells. I give a very simple example. If I hold a bucket full of water in my right hand and keep it holding the bucket for say 10-15 minutes, my hand will start getting pain. Even if I leave the bucket aside, the hand will still be, an arm will still be painful. Yeah. Now, if I can't bear or put up with the pain, I will take a pain relief medication and it'll be alright. But that pain will be due to some kind of a chemical reaction in my arm, isn't it? Because it remained under so much pressure and I kept on holding a bucket full of water. Brain works similar. If brain remains under pressure for a long period of time, chemical changes occur. And in that case, you would benefit taking from medication. Now, when it comes to medication, all antidepressants they might act differently, but the end result is almost the same. A good antidepressant should be able to treat depressive disorder. One antidepressant is preferable. Now, I'm not talking about treatment-resistant depression, which is an entirely different category, and there will be a separate video on it. But ordinary depression, which most of us develop, is totally, fully, 100% curable. One antidepressant is satisfactory. Sometimes in severe depression, you might need a small dose of antipsychotics with it. And the reason behind it is, in severe depression, we may end in developing two additional symptoms. One, we might our mind start going into states of reality distortion and start playing tricks on it. So we may become paranoid, or we may start becoming quite negative, or our denial to happiness or the reality became so intense that we need medication for this. An antipsychotic medication in small dose to assist antidepressant to improve its function. So antidepressant will cure depression. Antipsychotic in a reasonable dose. Reasonable means a smallish dose, not the dose you require to treat schizophrenia, say. In a small dose will actually take us out from the state of reality distortion. Now, sometimes we end in developing somatic symptoms. So we start having lethargy, lack of energy, lack of motivation, body aches and pains, and the perception is that as we are breaking down. Now, for that reason, sometimes antidepressant works, otherwise you may need to add an anti-anxiety medication to it as well. A lot of times depression is associated with loss, but a lot of times it comes with some degree of anxiety as well. So sometimes a small dose of antipsychotic is useful to take the edge off that anxiety. They are the drugs which do not make you dependent on it. So none of the antidepressant or antipsychotics make you dependent on it. There are few drugs which cause discontinuation syndrome, and I'm going to make a separate video on it, but there is no established dependency with antidepressants or antipsychotics. So you can take them, even if you take it several months. Generally, what happens is the duration you take medication to get better and the doses required for you to get better are called therapeutic dose. That means, let's say, drug A you require to take in 100 milligram to get better in 6 weeks, hypothetically speaking. Then once you achieve the state where the depression is gone, but if you stop or reduce medication impulsively, the likelihood is that depression might come back. So at this stage, you need a specialist to give you advice. Usually, the medication dose is reduced from therapeutic dose, which, as we said, hypothetically speaking, 100 milligram of medication A, is to maintenance dose. Maintenance dose is usually half of the therapeutic dose. So from 100, you might need 50 milligram, but you need for another couple of months. So if 6 weeks is taken for you to get better, you might need another, say, 6 to 8 weeks additional maintenance dose before coming off antidepressants. Antidepressants are not for life. You are not expected to take them for life unless there are some specific circumstances and your psychiatrist advise you that you have to take it for life. Otherwise, under usual circumstances, maximum course of an antidepressant is generally the time you take to get better and twice as that time to take maintenance dose and then coming off the medication. On average, 3 to 6 months. Once you get better, you need to be careful. If you are able to identify the reasons which made you ill, avoid them or modify them, or change your lifestyle. Work-related stresses can be quite intense and we don't always give them that level of importance in our life when we are in the middle of our work responsibilities, dealing day-to-day stress, until and unless we actually trip. And then we realize that for the last 5 years, I've been working 10 hours a day, for God's sake. Why did I not think about it before? Think now. Only bring 3 changes in your life. Take a step back, reflect. Give yourself time for reflection. Number 2, look at your day. Divide it into some proportion for work, proportion for life, proportion for children, family, for your friends. All the social element needs to be in it. And always give a proportion of time to yourself. Don't forget yourself. It's very much like when we are traveling in an aeroplane. The first advice we get is, if oxygen level drops down, a mask will just drop in front of you. Put it on yourself first. Even if you are traveling with little children, you're not allowed to even help children before putting a mask on you. Because if your oxygen level goes down, done. You won't be able to help even your children. So the advice always is, put a mask on yourself first. Get your oxygen levels right first. Then you are able to put mask on everybody and get oxygen levels right for everybody you love. Look after yourself. Depression is 100% curable, but it's better not to have it. It's a dreadful condition. Look after yourself. Look after yourself. Look after yourself.